Welcome back, everyone, for our second topic in the Special Senses unit. In this lab recording, we're going to cover the ear, hearing, and equilibrium. Now, you may already know that the ear is important for both audition as well as equilibrium, but it's two different parts of the inner ear that are going to facilitate each. The ear is designed to capture vibrations in the external environment to give us a sensation of sound and also a sensation of our body's position. We'll first start this video going over the anatomy of the ear, and then we're going to talk about a couple different tests that we can use to assess hearing and also equilibrium. So in everyday life, the elastic cartilage on the lateral side of the head is colloquially referred to as the ear. But the ear is much more than just the thing that you put your glasses over or you put your headphones in. In fact, the ear has three different parts: an outer ear, a middle ear, and also an inner ear. But the inner ear can be separated into two different apparatuses, one of which will be useful for hearing, and the other of which will be necessary for equilibrium. The cochlea is the part of the inner ear that's going to be useful for hearing, and the semicircular canals as well as the vestibule will be found on the inner ear, contributing to our sense of equilibrium. So if I'm being honest, I think this is my favorite of all of the special senses. I think our sense of audition is fascinating, and how vibrations make their way towards the inner ear is quite amazing. So let's first go over the anatomy here with the ear, and then we're going to talk about how these vibrations in the external environment make their way all the way to the inner ear and back to the brain so that we can hear things. So first and foremost, you're going to see the outer ear shown over here. We have a middle ear, which can be found in here, that's separated from the outer ear by the tympanic membrane or eardrum. And then we're also going to have the inner ear, which is this bony structure, often why this structure is referred to as the bony labyrinth. So first and foremost, the structures of the outer ear. There are only two structures that we need to be aware of, and they are the auricle, also known as the pinna, as well as the external auditory meatus. The auricle, or the pinna, is what we colloquially refer to as the ear. But as I've already mentioned, there are many other structures that do in fact contribute to the human ear. Now, the external auditory canal, or the external auditory meatus, as we can also call this, is a long tube that travels back towards the tympanic membrane. And the tympanic membrane is the eardrum, which can be found right here. This is part of the external ear because it contacts the external environment. So that's a nice rule of thumb, is that anything that contacts the external environment is going to be considered part of the outer ear. The one exception to this would be the tympanic membrane, which will technically be a part of the middle ear, and we'll see that here very shortly. So the auricle is made up of elastic cartilage, and that's found most external on the body, laterally on both sides of the head. And we also will see the external acoustic meatus, which is where we will stick the Q-tip when we're probably not supposed to. We want to be careful when doing this as not to rupture or damage the tympanic membrane. Now zooming in here to the middle ear, we'll find the tympanum, or tympanic membrane, shown right here, and the external acoustic meatus, which can be found right here. Now, beyond the tympanic membrane, we're going to be in the middle ear cavity. And this is, in fact, a little space, and it contains three different bones that are all very small and called ear ossicles. These three bones are necessary to transmit vibrations from the external environment in the air to the fluid that's contained inside of the bony labyrinth of the inner ear. In order, this first bone is known as the malleus, the second bone here is known as the incus, and the third bone here is known as the stapes. The malleus, incus, and stapes are the three ear ossicles, and they all connect to each other in that order. What's going to happen is that vibrations are going to make their way from the external environment through the air, through the external acoustic meatus. They're eventually going to hit the tympanic membrane, causing it to vibrate. And when the tympanic membrane vibrates, that's going to push here on the malleus, which is attached to it. When the malleus is moved, it's going to push on the incus, which will then further push on the stapes. And when the stapes moves, that's going to push on a structure known as the oval window, which will then disturb the fluid inside of the inner ear. So the malleus, incus, stapes, as well as the tympanic membrane are all considered part of our body's middle ear. Now there is one other structure here that we need to note about the middle ear, and that is the eustachian tube, which can also be referred to as the pharyngotympanic tube or perhaps the auditory tube. But on the quiz and on the exams, it will appear as the eustachian tube. The eustachian tube is in fact a tiny tube that connects the middle ear cavity to the back of the pharynx. And for those of you that aren't aware, the pharynx is the back of the throat. So in fact, this eustachian tube is connecting the middle ear cavity to the throat. And the necessity of the eustachian tube is to help the equilibration of pressure between the middle ear cavity and the external environment. If we are to do a thought experiment, and we're going to imagine that the eustachian tube is closed, when pressures in the external environment fluctuate or change, that would cause additional stress on the tympanic membrane. If this were to happen, the tympanic membrane could be damaged, so the eustachian tube is present to mitigate the effects of pressure changing in the external environment. So in review, for the outer ear we have the auricle, also known as the pinna, and also the external acoustic meatus. Separating the external ear from the middle ear is going to be the tympanic membrane, and the tympanic membrane itself, as well as the three ear ossicles, the malleus, incus, and stapes, are all going to be part of the middle ear, as well as the eustachian tube will. Now, one last thing I will just mention here is that the malleus, incus, and stapes do get nicknames. The malleus is often referred to as the hammer, the incus is referred to as the anvil, and the stapes is referred to as the stirrup. These are common nicknames for these bones because apparently the malleus looks like a hammer, the incus looks like an anvil, and the stapes looks like a stirrup. But sorry folks, I don't see it myself, so I'm not going to ask you any questions on the quizzes about the hammer, anvil, and stirrup. You'll have to know these bones as the malleus, incus, and stapes. And you will need to know that those bones articulate in that particular order. So lastly here for the anatomy of the ear, we have the inner ear. Now, the inner ear really contains the most intricate anatomical arrangement out of all of the three parts of the ear. So it's important that we understand that part of the inner ear is used for audition and hearing, and the other parts of the inner ear are going to be used primarily for equilibrium. Let's go ahead and start with hearing, and then we'll make our way into the structures that are used for balance. So first and foremost, you can see the stapes shown right here. When the malleus pushes on the incus, and the incus pushes on the stapes is then going to push on the oval window, which will disturb the fluid here inside of what is known as the vestibule. And the vestibule contains two other structures known as the utricle and the saccule. The utricle and the saccule are sensing for movement in two different directions. But all I need you to know about the vestibule is that it's made up of the utricle and the saccule. Now, in terms of hearing, when that stapes disturbs the fluid in here, that's also going to be linked here to the cochlea. The cochlea is this spiral structure that's often described having this shape sort of like a snail shell or perhaps a French horn. But when I look at the cochlea, all I can see is a Cinnabon. Whatever it is that you see when you look at the cochlea, it's going to be this structure right here. Now, the cochlea is hollow, and it contains this green thing known as the organ of Corti. The organ of Corti contains specialized cells known as hair cells, and those hair cells are going to have stereocilia on them that will move around when the fluid is disturbed. So depending on the frequency of the vibration, that's going to determine where along the cochlea the fluid is going to vibrate and which set of hair cells is going to be activated. Once those stereocilia are moved around, that's going to send signals back to the vestibulocochlear nerve, which is cranial nerve number 8, and this nerve is going to travel back to the brain, which is where we're going to get our sensation of hearing. You can see this process loosely described here on this slide. The cochlea does contain the organ of Corti, and the organ of Corti is going to contain the hair cells. Hair cells have stereocilia, and when those stereocilia move, these hair cells are going to send signals down the vestibulocochlear nerve. It is the disturbance and vibration of the fluid inside of the cochlea that's going to create these signals that we perceive as hearing. So that's a very brief explanation of how hearing is going to work. But the other parts here on the inner ear are going to be useful for equilibrium. So what we're going to find here is that these semicircular canals are going to be very important for dynamic equilibrium. These are also going to be hollow, and what you might notice is that these different semicircular canals are arranged roughly 90 degrees from each other. So there's one semicircular canal here in the x-axis, one here in the y-axis, and one in the z-axis. This gives us the ability to sense movement in all three dimensions. So based on how our body's moving around, the fluid in the semicircular canals are going to move around, and that's what's going to contribute to our sensation of equilibrium or balance. You can see the vestibulocochlear nerve is also going to attach up here to the ampulla of the semicircular canals and take those signals back to the brain as well. We call this the vestibulocochlear nerve because our body's vestibular sense are our balance senses, and cochlear, of course, is going to refer to the cochlea, which is necessary for hearing. Now, in terms of the different ways that we can assess hearing, we have 3 different hearing tests that we're going to discuss throughout the course of this presentation. Deafness refers to a lack of hearing, and there are in fact 2 different types of deafness based on what is causing the inability of audition. We have conduction deafness and we have nerve deafness. Now, conduction refers to the ability of the vibrations of the external environment to make their way back to the cochlea. Some areas of the ear that often cause conduction deafness are the external auditory meatus, the tympanic membrane, or perhaps the ear ossicles. The way these are going to work is that if the external acoustic meatus is clogged by something, each of these can contribute to conduction deafness in the event that something is not working properly with that part of the ear. In the event that the conduction deafness is occurring due to the external auditory meatus, perhaps there's a buildup of cerumen, or earwax, in the external auditory canal, preventing those vibrations from making their way back to the tympanic membrane. Conversely, if the tympanic membrane is inflamed or very, very stiff, that can prevent the loose vibrating of the tympanic membrane and not disturb the ear ossicles as well. And in terms of the ear ossicles, if one of them is dislodged or perhaps fractured in some way, that can affect the transmission of vibrations back to the inner ear as well. In terms of nerve deafness, which is our other type of deafness that we have, this is going to refer to damage to the vestibulocochlear nerve directly, or perhaps damage to the receptors that can be found inside of the cochlea. These are the hair cells. If the hair cells in some way are not functioning as they should, despite the fact that there are vibrations moving back into the cochlea, they're not going to be transmitted into cranial nerve number 8. So because we have 2 different types of deafness, we're going to have 2 different tests that are going to help distinguish which type of deafness it is that we're experiencing. There are 2 tests that we're going to do together, and each of them is going to help us distinguish what type of deafness that we have and in what ear that deafness is occurring. The first test is going to be the Weber test. The Weber test is carried out by taking a tuning fork, placing it medially on top of the head, and activating the tuning fork. In the event that the hearing is normal, we're going to hear the sound of the tuning fork equally loudly in each ear. However, in the event that we do have some type of deafness, there is going to be a difference between the right ear and the left ear. With sensory neural deafness, you actually hear the sound louder in the ear that's unaffected. But with conduction deafness, you actually hear the sound louder in the ear that is affected. So in the event that the Weber test indicates that hearing is louder in either the right ear or the left ear, let's take the right ear for example, that's going to tell us that we either have sensory neural deafness in the left ear, or perhaps conduction deafness in the right ear. Because conduction deafness is heard louder in the affected ear, if we're hearing the tuning fork louder in the right ear, this can indicate conduction deafness over there. But sensory neural deafness is the opposite. We hear it louder in the ear that's unaffected and is not experiencing the deafness. So, if we hear the tuning fork louder in the right ear, that can mean that we actually have sensory neural deafness in the left ear. So we're going to need to use one other test to distinguish which type of deafness that we have in which ear. And that test is known as the Rene test. The Rene test is comparing bone conduction to airway conduction of vibrations. And the way this test is carried out is by taking the tuning fork and placing it on the mastoid process behind the ear. Once the tuning fork is activated, you'll leave it on the mastoid process until the patient can no longer hear the sound. And once the patient can no longer hear the vibrations of the tuning fork will then be moved right in front of the ear. And what's supposed to happen in the event of a healthy ear is you're actually supposed to be able to hear the tuning fork after it's been taken off the mastoid process and you can no longer hear it. In the event that these are not the results, that's going to indicate the particular ear that has the problem. If we carry this test out in reverse, and we start with the auricle and then move to the mastoid process, if we're still hearing this, that's going to indicate conduction deafness in that particular ear. So the Weber test and the Rene test are always given together to give us an idea of which ear is experiencing the deafness and what type of deafness that ear is experiencing. Now there is one other exam that we can do for the ear, and that is the otoscopic examination. This examination takes a scope and looks at the tympanic membrane. And we're examining the tympanic membrane to check on its overall health. We're looking for things like redness and enlargement of blood vessels, similar to the characteristics that we were looking for when we were using the ophthalmoscopic examination. It's also very important to note how much earwax is in the external canal, because that can also be a cause of conduction deafness. So with the ophthalmoscopic exam, we're trying to examine the retina. Here with the otoscopic examination, we're trying to examine the tympanic membrane. Now that will conclude the information that you'll need to know about hearing. We're going to real quickly jump into equilibrium and balance and talk about two different types of equilibrium and two different tests we can use to assess it. First and foremost, we need to understand the difference between static equilibrium and dynamic equilibrium. Static equilibrium is the equilibrium that we feel when we're moving in a straight line or perhaps when we're sitting still. When you're sitting in a chair or perhaps standing still, you're going to feel gravity acting on you, and that is your static equilibrium. Linear movement is also going to be the same way, and it is the saccule and the utricle that are going to help assess our body's static equilibrium. But it is the semicircular canals, on the other hand, that are going to help assess our body's dynamic equilibrium. And this can be referred to as our rotational equilibrium. And if we can remember what I mentioned about the semicircular canals, I stated that there is one semicircular canal in each plane. This is going to indicate that we can assess our balance in all different directions. So this is our rotational equilibrium, which would be an example of when we're on a roller coaster. When you're shaken up on a roller coaster, or perhaps are in a fast-moving plane, the fluid in the semicircular canals is going to be disturbed, and we're going to experience this equilibrium in many different dimensions. Now lastly, there are two different tests that we're going to use to assess equilibrium, and those are the Barony test as well as the Romberg test. The Barony test is quite simple and quite sadistic if you ask me. You'll have the patient sit in a swivel chair, and you're going to spin them as fast as you can. After the individual's been spun, you're going to open their eyes and look for what is known as nystagmus, which is the wild movement of the eyes, and you're also going to measure if that patient is feeling sick. This is not a test that I like to volunteer for because I tend to get very, very motion sick. But the Barony test gives us a way that we can assess our patient's rotational or dynamic equilibrium. The Romberg test is our final test for equilibrium, which is carried out by telling the patient to stand with their feet together and their face forward. This test is going to assess static equilibrium as the patient is going to be still. Now what we're going to be looking for in our patient is swaying back and forth. What you'll often find is that when the Romberg test is carried out with the eyes open, there's much less swaying than when the eyes are closed. Visual input is critical for maintaining our body's static equilibrium. And this is why when you get sick in a moving vehicle, you're told to look out the window at various still objects. So these are your two tests that will be used to assess equilibrium. The Romberg test will assess static equilibrium, and the Barony test will assess our rotational or dynamic equilibrium. This will include the second installment of our special senses unit, the ear and equilibrium. At this point, you should have already watched the video on the eyes, so if you have not done so, make sure that you've watched that video before proceeding to olfaction and taste. If you have any questions, please be sure to reach out, and I will see you all in our next lab recording, where we'll start discussing our final special senses, which are going to be smell and taste.